As part of the Connecting the Dots project, a group of caregivers and healthcare providers from Huron and Perth counties developed several tools to be used by patients and caregivers. One of the tools is this healthcare journey binder. Some caregivers can get overwhelmed, and that could lead to stress and exhaustion. This binder will help you stay organized. Being organized reduces stress by making your information easy to find and manage. This binder helps caregivers and patients keep their healthcare information in one place. It comes with several sections, and you can remove ones you don't want or add new ones that suit your needs. It's not just for doctors or hospital visits. Someone coming to help you at home might need to know more about the person that they are helping care for rather than just medical information. Here are some things to consider. Don't feel like you have to fill in the binder all at once. Take your time. Take a few days or more if you need to. Do as much as you can when you can. You can remove any section that you don't need, or you can add any sections or pages that you might find helpful. Every section has a page or two called About This Section. Review these before you start. They help you understand why it's important, how to use it, and what each section is for.
Personal information.
In this personal information section, you can add basic information about yourself or who you're caring for. Not all of this will be of interest to a physician, but remember, care coordinators, in-home nurses, and community service providers may find this information helpful when creating services for you and your loved one.
Medications, therapies, and allergies.
This section is very important, especially if you are seeing a new doctor or specialist for the first time. Make sure to read the first few pages about the section and review 5 questions to ask about your medications. You can track your allergies, any non-prescription vitamins and supplements you take, your vaccination history, and other therapies you are engaged in, like physiotherapy, aromatherapy, or exercise classes.
Medical histories, vital signs, activities of daily living.
In this section, don't worry too much about the medical jargon. All the important terms are explained at the start of each section. This section has a place for test results and to write down dates of hospital visits and procedures that the patient has had. It also has templates to write down vital signs like blood pressure, heart rate, and weight. If you run out of space, you can make copies of any pages and add more. The section on activities of daily living can be very helpful. If someone is coming from a community agency to help my husband while I go out, it gives the provider a good idea of what his routines and preferences are. Over time, it will also help keep track of changes in his overall condition. This is a section that can help you get more out of your appointments because you'll be able to provide the information a doctor or nurse wants quickly and accurately.
Consent and legal matters.
This section explains some of the legal terms that you may hear. If you have important documents, use the pocket in the back of the binder to keep them safe and readily available.
Healthcare team and notes.
This section in the binder allows you to write down who is helping you or the person you care for on your journey. If you have a doctor, hospital visit, community support, or nursing help, the list of people and agencies you might need to contact can be quite extensive. You can write down what everyone does and when and where your appointments are. It can also act as a communication log to record who you spoke to, what questions you asked, and what the answers were. Don't feel like you need to use all of these. Remember, remove anything that you won't use to help make the binder best for you.
Care templates.
In this section, there are many helpful templates. There are charts and sheets for you to use to record people who can help you at home, meal planning sheets, your daily routines and preferences, and blank calendar pages for planning further into the future. Use this back pocket as a place for important documents you want to keep handy. You can also use it to hold receipts, prescription printouts, or test results. It's for you to decide what goes in here, even if it's only temporary. Lastly, and a few final thoughts. If you remove documents from the binder, make sure you dispose of them safely. Ask at the hospital, doctor's office, or pharmacy if they have a secure way to dispose of confidential information.
My name is Donna, and I'm a caregiver for my husband. When we were told he was ill, it was overwhelming. I was one of the first people to use the binder as an incredibly valuable tool.
Thank you for your time, and I hope that the binder helps you on your journey as a patient or caregiver.